Hi, I'm Bob. I'm from Northville and I'm 62 years old.
Bob, what kind of problems were you having that caused you to come into our office?
Um, Primary one would be my leg pain.
What did it feel like to you? Like how bad was it at its worst?
Well, sometimes at its worst, because I'm an avid basketball player, even though I have this pain, I was almost being paralyzed after certain workouts.
Would you call it as pain, or was it like pins and needles, or
Pins
cramping?
and needles. No, it wasn't cramping. It was definitely more pins and needles.
Like a tingly sensation?
Yes,
yes.
yes.
Was it in both legs or one leg?
Both legs.
Both legs.
Both legs.
So so it affected your basketball?
Yeah, it affected my basketball.
Did it get to a point where it affected sleep, or was it more like physical activities?
Some sleep, but it was even sometimes walking, especially long walks.
So you felt a lot walking and doing some of the things you enjoy. Did you prior to coming in, did you go to other doctors, specialists to try to find help?
Yes, I went to a neurologist, and I also went to an orthopedic surgeon, because they would want to really focus in on the back and the vertebrae. And
So they did what? Did they take x-rays, CAT
X-rays, CAT scans, MRIs.
Any results back that they found a problem?
Just for the first time, because I've been coming here for almost 5 years, with Dr. Long, a year and a half ago, one of the MRIs showed a bulging disc.
Bulging disc.
Right.
And you found that out recently.
Recently.
But back when you came in,
there wasn't anything.
So you really didn't know what to do.
I didn't know what to do.
You just knew you didn't like it.
Right.
So as we film this, you've been coming in 5 years to keep the body working well.
Right.
Back when we started, I know it's been a while, how fast do you think you started to see changes that were positive for you?
Oh, almost immediately.
Like a week or two maybe, or?
A week or two.
Started seeing changes?
Started seeing changes.
And you also drive a pretty good way to get here, like maybe what, 35, 40 minutes?
Yes, 35 or 40 minutes.
Why would you say that you do that drive when you have a lot of other options out that way?
Well, just quality of care. I've seen results. I get very deep into theory in that, and Dr. Long is very brilliant man in his field, and I really, really respect that.
Right. So that problem you had compared to where it is now, overall, you do pretty well most of the time?
Yes, definitely.
Yeah.
And I can't stress enough that, for most people in any age group, coming 5 years, you tend to just deteriorate in life. And I actually feel better than I did overall 5 years ago.
Better now than 5 years ago.
Yeah, absolutely.
And the treatments that we do, I know you've been to other types of chiropractors and specialists. Right. Would you describe our treatments as painful?
Definitely not painful.
Twisting of the neck, cracking of the back, anything heavy that's kind of scary?
No bone cracking.
No bone cracking. So comfortable adjustments.
Comfortable adjustments, absolutely.
And somebody that has leg pain or neck pain, would you recommend they at least hear what we do to see if it can help them?
1,000%. 1,000%.
1,000%.
And one of the things I can't stress enough, I deal with a lot of people besides teaching in Wayne State. I have 2 Methodist churches in Dearborn Heights, and a lot of them are elderly, especially, but they're constantly talking about their physical problems.
Right.
Let alone the ones I see in the hospital. I just see normal conversation.
Talking about the problems they have, but yet they're not doing things that have worked for you.
Right, absolutely.
Why do you think they do that? Do you ever have conversations with them as to why? Do they think it's just normal old age, or?
I think a lot of them have been brainwashed by certain medical doctors who've just sort of said, surgery is your best option.
Yeah.
And truthfully, I think a lot of them who turn to alternative medicine, whether it be chiropractic or just vitamin gurus or what it might be like that, is because they have more of a fear of surgery. It's not because they became a believer in that.
Right, right.
It's just that was the option that was less painful.
Yeah.
And that frustrates me because, to me, it's going to take them a lot longer to see that that's probably the best way to go.
Right, yeah. Yeah, I find that a lot of people just, I've had a lot of people that come in and just say things like, I just didn't think it could be this easy.
Right.
And my response always back is always, when you take care of the only body that God gave you appropriately, it takes care of you. And so I hear that a lot. Well, I can't believe it only took that amount of time, or I can't believe that's all it took. I have a lot of people that are surprised that they didn't have to get the surgery. And there are times that surgery is necessary, and there are times that drugs are necessary. But in my experience, if somebody's proactive and they want to get better and they learn basic principles, I have very few people who actually need to get the surgery, and most of my patients will get off medications. Were you taking any kind of painkillers or muscle relaxers or cortisone shots?
No.
They didn't even give you that stuff?
No.
Nothing like that?
Well, because I just have always had a physical problem. Overachievers tend to get this just stomach kind of thing.
Mm-hmm.
So any of the painkillers would tend to really upset my
So you
stomach.
kind of stayed away from those?
Absolutely.
Yeah.
But the pain was tolerable.
Okay. Good. Good enough. Thank you for your time.
All right.